Hello, I'm Dr. Kahan. How do you do? So I understand you're here for a cut, a fall.
Yeah, I was walking and I fell down. I need some stitches.
Right, and so they put the stitches in, the sutures in, and you're ready to go.
Yeah, they just put the sutures in and they were ready to discharge me. So
Right, now do you mind if I ask you a couple of questions about alcohol? We routinely ask people about alcohol after a fall or an injury.
yeah, not a problem. Yeah.
Okay, so how many days in a typical week do you drink?
Uh, mostly on weekends, but it really depends on the day.
Right, so what would be the most amount of alcohol you'd have on any one day?
Yeah, I guess on the weekends I'd have 10 beers or something like that. Yeah.
10 beers on a weekend day. Yeah, that's above what we recommend for safe alcohol consumption, and that level of drinking is associated with problems like falls and injuries. So I am concerned about that. Do you see any connection between your drinking and this fall?
No, I just fell.
And what was the reason for the fall?
I was just walking and I fell. It was a weekend, so maybe, I don't know, maybe I was drinking a little bit more than normal.
Right, so you were drinking more than normal, and you had this fall that required this emergency department visit, and they had to suture you up. Where do you think you would want to go from here? Do you have any concerns about your drinking?
Not really, but now that you say it, I guess I could cut back.
You would be willing to consider cutting back? Possibly, you'd think about it.
Yeah, I would think about it for sure.
So we have medications called anti-craving medications that are very safe and often effective. They have few side effects, and they do help people reduce their urge to drink. Would you be interested in a prescription for one of those?
Oh, really? I didn't know they had stuff like that. Yeah, I don't know if I would start today, but
Well, that's okay. Another option is we have a local rapid access addiction medicine clinic that's right near our hospital. You could be seen there within a few days. I could give you contact information, and you could discuss your alcohol use with one of the doctors or counselors there.
yeah,
How would that be?
sure, that sounds great.
Okay, fantastic. I'll get you that information and be right back.
All right, thank you, doctor.